The intercruciate ligament, or the ACL, is one of the main stabilizing ligaments of the knee joint. It's located in the center of the knee joint, and it functions as a primary stabilizer to prevent the tibia from sliding forward on the femur, and also to prevent excessive rotation of the knee joint during activity. Most people will feel or hear a pop in their knee at the time that they tear the ACL. And this is accompanied usually by a significant amount of swelling. It starts almost immediately after the injury. There's usually a significant loss of range of motion, and it's usually very difficult to bear weight on the injured leg because of pain. Complete tears of the ACL do not heal on their own. So in those cases, surgery is usually recommended, particularly in young active patients that really need stability of the knee joint in order to participate in high-level athletics. Older, less active patients can be considered for non-surgical treatment. In that case, usually is some participation in physical therapy and emphasis on regaining strength and range of motion. Simply sewing the ACL ligament back together is usually not a viable option. So typically you have to rebuild or reconstruct the ligament. Usually we'll use a tendon taken either from the patient themselves or from someone else that's donated their tissue to rebuild that ligament. Typically, ACL surgeries are now done as outpatient surgeries. They're done arthroscopically, meaning that there's no need for large incisions. The initial recovery is about 4 to 6 weeks, and that's to get back to light everyday activity like walking, climbing stairs. But full recovery, getting back to full activity and sports participation is more on the order of about 6 to 12 months. One of the most important parts of the recovery process is physical therapy. And the goal of physical therapy initially is to, one, regain range of motion, and then also to regain strength in the knee, particularly in the quadricep muscle, which typically shuts down right after surgery and takes several weeks to start building that muscle back, and often up to a year to really get full strength of the quadricep back. Although not all ACL injuries are preventable, proper training exercise can help reduce the risk of an ACL injury. Maintaining good strength in the leg muscles, particularly quadricep and hamstring, maintaining good core strength, and then placing emphasis on proper technique and knee position during jumping and landing, as well as when performing like pivoting and cutting maneuvers, can also help lower the chances of an ACL injury occurring during sports participation.